All righty. Well, good afternoon. Welcome again to our third learning network for the WA COVID-19 program. This is a state-sponsored testing program for fire and EMS agencies. We are really grateful to have you all here with us today to chat a little bit about the tools and strategies that we'll use to prepare and respond to flu season using diagnostic testing tools like BD Triplex. I'm Hannah Rapp-Brown. I'm Director of Community Programs here at Health Commons Project. We are a Washington-based nonprofit and DOH COVID-19 testing team's implementation partner for this program. I'm joined today by my counterpart at DOH, Bianca Wilson, the Testing Partnerships Coordinator at DOH, as well as Scott Williams from the Office of EMS at DOH. From the Health Commons side, you also have Brian and Erica here to help ensure that we have a really smooth session today. Wonderful. So today's session, we'll start with just a quick background about WA COVID-19. I know many of you here today are agencies that are enrolled in our program, so familiar faces, thanks again for being here. Then we'll talk a little bit about the Learning Network objectives. Why are we also here today? What are we talking about? What do we want you to walk away with? We'll then dive into a little bit of an introduction orientation to BD Triplex, so this COVID and flu testing solution that we've just added to our program. I will do a live demo, and then we'll talk about some of the key steps to implementing this at your agencies. I'm going to try to walk us through those pieces pretty quickly because I really want to get to what I think of as like the meat of today's session, which is really our group discussion, between you all as fire and EMS agencies, how you think you plan to implement this at your agencies, with your staff, with your community members. So we'll try to spend most of our time in that space before we wrap up.
Good afternoon, everyone. My name is Bianca Wilson. As Hannah shared, I'm a testing partnerships coordinator and also partnering with Health Commons on this COVID-19 project. This project is funded by a health disparities grant that we have through the Centers of Disease Control. And our main goal is trying to really support some capacity building activities with rural and EMS agencies, fire and EMS agencies that serve areas where there's not a large availability of testing services, and really trying to engage you all in some capacity building activities to help you jumpstart being able to provide testing to your community. Just recently, we have been working very hard to implement a new testing technology in this program. It's called Triplex, and it tests for not just COVID-19, but also flu A and flu B. The name of this particular technology is BD Veritor Triplex. And so Hannah will go into, kind of more of the details about what the technology looks like. But through this program, you all will also be able to tell if someone presents with symptoms of a respiratory virus, if it is COVID or flu A or flu B. And so the goals of today's session are to kind of introduce you to the technology, show you how it works, give kind of a high level overview of how you can actually implement the testing technology into your testing service, go through kind of an overview of what will need to happen with the reporting, and maybe getting connected to some other agencies that you all work with when being able to provide testing services, like medical program directors, surveillance and epi on our side, your LHJ and whatnot. So we will run through all of the details that we think you all need to know in order to be able to successfully implement this new triplex technology into your programs.
Thanks, Bianca. Wonderful. So as Bianca shared, we sort of call this test Triplex for short. It is a point of care antigen test that, as Bianca shared, results for COVID, flu A, and flu B, all in one sample, which I think is just like a really exciting capability to be able to add to this program's menu of testing technologies for our agencies. There are sort of what I would characterize as like two parts to this, to using this technology. There's an analyzer and the test cartridges. So you can see those both on the image on this slide. Thankfully, it's a calibration-free instrument. It's really easy to use, and it has a rechargeable battery up to 8 hours for testing, which I think makes it a lot easier to use in the field. There are a couple different modes of testing with this analyzer. One is Analyze Now, where you're sort of present, you're inserting the cartridge. I'll walk through that today. And the other is called Walk Away, where you're just able to plug in the analyzer, insert the cartridge after performing the swab, walk away, and the device will self-time the 15 minutes and then display the reading. So again, this can kind of work for you and your agency, depending on how you plan to implement it, whether it's something you're offering in the field or at the station. You can kind of feel out which of these modes is going to work best. So let's talk about accuracy. I'm sure that's a question that you're all interested to know. So I wanted to share some data that's actually from not the manufacturer, from a study done that was published in the American Society for Microbiology. And I really wanted to emphasize, I think, some of these values here. So the test, when it comes to COVID, flu A, flu B, it is highly accurate. What you're seeing here are really the positive percent agreement and negative percent agreements for those 3 different pathogens. For COVID-19, BD Veritor's Triplex test correctly identified 86.7% of cases that were confirmed to be COVID. For flu, 100%, for flu A, 100%, and for flu B, 100%. Now, it also, on the opposite side, correctly identified like a negative test for COVID in 99.5% of cases. Highly accurate for flu A and for flu B. So I always like to bring in sort of like, what is an outsider's perspective on this tool? What did a separate study done by, not the manufacturer find about this technology? And I really kind of enjoyed this quote from the article around this dual detection capability is critical when overlap occurs between the COVID-19 pandemic and flu season, which I know we're all sort of marching towards right now. Our goal to be able to offer this through this program today is to provide this tool to equip you to really navigate the next few months. So at this point, I think we're all subject matter experts personally, professionally on how to do a COVID test. And with this one, it's really no different. I would say maybe the one piece that's net new, if folks are more comfortable with an at-home, eye health test, is the analyzer. And really that's just there to help read the result, because the cartridges do have their, have markations for these different pathogens. But the process will be very similar to what you're all accustomed to at this point. You'll start with a shallow nose swab to collect the sample. You'll dip it in the reagent solution, swirl it around for a few times, drop 3 drops on the sort of cartridge, and then after 15 minutes, you'll insert the test card into the analyzer for this digital readout. Really quickly, the analyzer is going to tell you for COVID, flu A, and flu B, if any of them are positive or negative. Perfect. All right, so I'm going to do a live product demo for you all. I'm really excited because many, many years ago, I used to work in health technology in the Bay Area, and we always required our startups to demo their products live. And it was always a test to see if everything worked as expected. So I'm going to put myself on the spot here and do this all for you. All right, so I'm going to start by showing you all this analyzer. Hopefully you can see this. My blur background isn't taking it away. So this will arrive in a box with instructions, which again, you're always welcome to review. It's about the size of a smartphone these days, and it comes with a charger that you can use to charge the device when it's at the station. And then also, again, as I noted earlier, if you're using it in the walkaway mode, it does need to be plugged in. In addition to the analyzer, you'll also receive a box of 30 tests. Included in that box, you're going to get a lot of things. You'll get your 30 swabs, you'll get 30 tubes of reagent, you'll get this really cool little holder for the reagent tubes. You'll receive 30 cartridges. And most importantly, you will receive your control swabs for COVID, flu A, and flu B. That will be the first activity you do when you receive your supplies, is doing your quality control test. So you'll go ahead and use these identified swabs to basically confirm that your analyzer is correctly reading the results. Now, I'm going to show you all what it looks like to actually do one of these tests. So I'm going to go ahead and turn on my machine. It's going to do a very quick self-test, make sure it passes. And then it says insert test device or double click button for walkaway mode. But 15 minutes ago, I did a quick self swab so I could not make you all wait 15 minutes for the result. So we're going to go ahead and do that live now. But basically, again, just to follow the steps that we were all so accustomed to at this point, you know, your EMT or your personnel will go ahead and swab the patient. They would dip it in the reagent, swirl it around, drop it onto the cartridge, and then wait 15 minutes in this analyze now mode, wait 15 minutes before inserting that cartridge. So that's what we're going to go ahead and do. So it's inserted, it's reading. And it's negative for me, which I am feeling good, but you know, always good to confirm. So I just want to check the chat. I know we're kind of been moving a little quickly. Erica, any questions we should answer?
No questions so far, Hannah. Yeah, great explanations.
Thanks. All right. Well, let's go ahead and get into some of the key implementation steps. All right. So while COVID-19, as part of releasing this new testing technology to the program, we have, and it'll be put in the chat and also sent out later, we developed a toolkit to make sure that our agencies have a clear set of instructions on how to implement this new technology. I'm just going to pull out a couple of what I feel like are some of the most important steps to get through or to talk through as a group. But rest assured, there is a much more detailed toolkit on our website and that you'll receive after this session that really walks through, you know, sequentially how to implement Triplex. But let's start with licensing. And I want to say this is like one of the easier steps, if you will. So a little bit of background. BD Triplex is this point of care test. It's using human specimens, so, you know, nasal swabs. And as such, the test does require providers to have a medical test site license. Thankfully, the EMS section of DOH maintains a single medical test site license for all CLIA waive tests, and this covers all licensed EMS agencies in the state of Washington. BD Triplex is a CLIA waive test, and I walk through that so that I can say, in short, your agency does not need your own medical test site license to provide Triplex. You can use DOH's medical test site license to conduct your Triplex testing. So as I said, this is kind of like the easy step because great, DOH EMS office is taking care of it for you. All right, so through the WA COVID-19 order portal, agencies that are enrolled in WA COVID-19 can request these supplies. They're available, they're already on the portal, so you can already order. Typically, once you order, supplies arrive anywhere from a few to basically a maximum of 7 days later. It's really quick turnaround. The team at DOH is all stars when it comes to processing your orders. Just a couple sort of quantity supply recommendations. For the analyzers, again, this device here, you can order up to 5 per agency, but if you are requesting more than 2, please just provide at the bottom of the page some additional comments about how you're thinking you'll implement it. One way of sort of making that determination is, say you're planning on implementing Triplex as a testing solution from your station. You may only need 1 or 2, 3 analyzers to meet the demand. But if you are taking more of a in the field on EMS calls approach, that might make more sense to have an analyzer and cartridges on each of your aid vehicles, which could, based on the size of your agency, increase the number that you need. So go ahead and just put into the order portal. Again, if it's up to 5 per agency, please request what you need and let us know. The test cartridges, again, these small little sticks, if you will, 30 of these come in each box, and that is the minimum order. Okay, so a testing protocol. EMS personnel, again, may administer the Triplex test. You're an authorized administrator for this point of care test. There are, a couple stipulations that enable that capability. Really, I think one of them is that you should have a protocol for testing in place, established with your agency's medical program director. Some recommendations for what you might think about including in that protocol would really be just sort of describing when the test would be offered or provided by your agency, how consent would be captured, and a narrative that your providers can use to really document the scenario in which the test was provided, the result, the provider's recommendation, and then that patient's decision-making surrounding the result. We do have a couple resources. Again, these will all be sent out after the session today that can help you with your protocol development. So we've got a number of materials from BD Veritor, which I think would rightly serve your protocol development. Reporting. So because this test is resulting for 3 different conditions, we do want to talk about reporting requirements. There are still reporting requirements for providers to report positive COVID-19 results to public health within 24 hours of that test. Flu A and flu B, they're not a notifiable condition, so you do not need to report any results to public health related to that test or that result. For this program, we do have a couple options for agencies to use to report those positive COVID-19 results to public health. One is a tool called Simple Report. This is a free online solution provided by CDC. It is sort of our recommended reporting tool when it comes to reporting results to public health. Again, it's a digital tool. You create an account. You have to include some information on setup. We have training materials on how to get set up with Simple Report. But then, like any online system, when you test someone and it does come back as positive for COVID-19, you add some information about that client into this secure online system, and it's automatically sent over to public health, both to DOH and to your local health jurisdiction. Now that's like your digital tool. Another option is to work more directly with your local health jurisdiction, local public health in your county or your region to set up a sort of information exchange so that when you do encounter someone who tests positive for COVID-19, you're passing that information to them. So you're not required to use Simple Report. It is a recommended tool. We do feel like it's relatively easy to implement. We have instructions on how to do so. But if that's not a good solution for you for any number of reasons, again, we can help you coordinate with local public health to set up that information exchange.
Yeah, we have one question from Chief Halbrick about will we need any proof or copy of the testing license in the event of any audit or inspection? So relating back to the MTS license that you spoke about.
Great. Yeah. Thanks, Chief. And thanks for being here. I think it's probably a good idea to have the medical test site license on hand. We will send that out after this call. It's currently on the WA COVID-19 website. Thanks. Yeah, and Mike just dropped it into the chat. You've got there the license number, but we also have just like a PDF printed or printable copy of the license that you can sort of store for your records. And that their license is good for another 2 years. It renews every 2 years. Group discussion. And I really want this to be a space, the second half of our time here together, to really hear how this technology does or doesn't fit into your agency's EMS practices. And for those who really do think it would be beneficial to implement, I want to hear how you plan to do so and any watch outs you have based on what you heard today. For those who are maybe having some second thoughts, I want to know like what's driving them. What was information that may sway you one way or the other? I am going to start with my resident plant, Chief Sean Ford. He was our pilot partner in while COVID-19 for this program back in September 2022. So he's been with us the whole time and quickly advocated for this technology to be part of this program. So Chief, I might ask you or invite you to tell us a little bit about why you had wanted or advocated for this COVID flu test and sort of what was happening in your community and at your agency at that time.
Yeah, thank you. Yeah, it took a little while. It was about a year ago, I think it was, we pitched this idea. And the reason was where I was at the time, in a very rural area, a lot of walk-in medical patients, but also still a lot of hesitance to really want to get tested for COVID. But especially during the height of respiratory infection season, there was a big ask about flu. People call us regularly for flu. So my request was, well, let's just do both. Yes, I can test you for flu. By the way, it happens to test you for COVID at the same time. What we were hoping is that was going to allow, or more people would be willing to come in and get tested at that, especially during the height of respiratory infection season, where we're becoming overwhelmed with seasonal flu as well. We could find both. So both of those opportunities to be tested for both is great. Where I'm at now, our plan is to carry them on our actual ambulances. Wanted to get it now. Late summer is a good time, just as we're just now starting to get into the flu season. In fact, I don't know about the rest of you, but I'm actually at an appointment this afternoon to get my updated COVID and flu vaccine here in just a little while. So we're just getting into that time. So it's a perfect time frame, getting this on the ambulances ahead of time, hopefully, so we can make this available. And we'll see what happens. And we did order a bunch.
Thanks, Chief. Now I'm going to lean on some information you shared with me, which is, you have experience with the BD Veritor system and with Simple Report. Could you sort of share some lessons learned or some tips that you might have for others that are more new to this testing technology and to reporting?
Yes, so it'll be good and the bad. So the BD Veritor is what we got in the county probably 3 years ago when we were doing employee testing. That's when we first got the BD Veritor. So all of our agencies in the county, that's what we've been using professionally with that system. At the time to get those materials, you had to be your own clinical site. So we got our own clinical license so we could order the materials and get those. Don't have to, but as part of that was to sign up for something like Simple Report. So here's the negative. I do not like Simple Report. Just put it out there. It's very difficult to log into their system. It was simple enough to get started, but after that, trying to get logged in later, I don't know if you have a tight IT structure with whatever agency you work at, a lot of security, it'll be difficult to get in and get that. So it might be easier to just get a relationship with your local health department and report that way. It seems simple enough for Simple Report, but I did not find it to be the reality.
Well, Chief Baker, I know you recently received your supplies. Can you tell us a little bit about, have you started using it, where you're at in your implementation?
Well, and I think we're going to do it, do our, put it on our website and little outreach that it's available here, and so that they can come in, and then we can put them into a, safe place to get the sample and start the process. But rather than putting it, on the aid unit, because we're working so closely with Fire and EMS that, if they're not carrying it, they're going to get more patients and get more likely to get that than we would. So we're kind of as a backup. We're not the primary, we're a secondary provider. And yeah, they're gonna hit more of the risk than we are, but you know, kind of let them know it's here, and we can help them out with that.
And now that kind of feels like maybe a difference that I might be assuming. Chief Baker, you sharing it, through your incredible community outreach channels, the radio, local news. Chief Ford, are you planning to kind of market this widely or have it be more as part of your like EMS service delivery?
Even more of our EMS service. We're in a bigger metro area, and our concern was, well, there's not as much of a need to where we're at to make it available. If we did, I think we'd quickly become overwhelmed with the testing here. So there's lots of other testing options, thankfully, within our community. So we're probably not going to be as widely advertised. I'm not keeping it secret, but more of a patient contact issue than marketing others.
Chief Baker, I think one thing that we got to celebrate in your spotlight was this incredible sort of community outreach work that you've done for the OTC distribution. Could you maybe speak, since we've got some folks here that aren't enrolled in the program today, to some of the channels that you've used to get the word out?
Is, I think, kind of a benefit that I'm in a small town, and so I have a limited number of channels and good access and experience with those channels. So, those long-standing relationships are really easy to, make a phone call or an email and I've connected. So it was really easy for me to use, the newspaper, the radio station, and our website, and have really pretty good distribution. Our association having their Facebook. So, 4 items, and that was about the best we're going to do.
Seemed to work really well.
It
So, yeah. Chief Halbrick, I'm going to come to you because I know when we were emailing about this session, you had expressed an interest in an over-the-counter, so more of an at-home COVID flu test. I'm curious, does a point of care solution where, your EMS personnel are actually doing the administration, will that work, or is it going to pose some barriers on the implementation side?
So yeah, so with the COVID side of things, that was our plan, is we didn't necessarily want to bring people who are showing symptoms really into the station, and the individual that will be, or that is distributing the test is our community relations person. He's non-fire, non-EMS trained, and so we didn't really want to kind of put him in that role necessarily. But as far as implementing the BD Veritor portion, while it probably won't be something we would necessarily really put out there as far as being done in the station, I foresee it being a huge asset on our medic units. As you and I have discussed quite a bit, we've been really pushing for a community paramedicine program. And this kind of falls with that. So when we're doing some of our home checks, when we're going on some of these calls for people who are having flu-like symptoms, et cetera, a lot of times this can really most likely prevent an unnecessary trip to the ER or unnecessary transport, which creates a bill to the individual and so on and so forth. I mean, unless somebody's, ill needing additional medical care, if they're just looking for some sort of a diagnostic primarily, we can provide that at the scene and then do a treat and release or whatever is going to be appropriate. But as far as for our application, I see this being definitely more of an in the field sort of deal.
I'm hearing like really good signals, right? That this is something that even for agencies that weren't necessarily planning to or advocating for this technology, that it does fit in. I'm curious, Chief Baker, Chief Halbrick, Chief Ford, some of the other key steps that we talked about for implementation, in particular, this protocol development. Do you expect any challenges in having to develop those with your MPDs? What are some of the key questions that you might have at this time that would be helpful to answer to help develop that resource?
I guess I would say if you don't already have it, this fits good into, we have a seasonal pandemic protocol so when we do reach crisis standards of care, where we have so many patients reporting to the ED with respiratory symptoms, which could be flu and or COVID, this is another tool for that. Just, it's usually a temporary purpose. It's not all the time. So if you don't already have that in place, I would strongly suggest getting with your medical program director, getting something like that created. You need to start the metrics now, working with your local health department and hospitals, figuring out what those metrics, where you want to meet to trigger that as well. Probably this would fit in as part of that testing. It strengthens, part of that is leave at home unless you have these symptoms, which before has been, fever and severe, difficulty breathing. Now we have one more test we can complete at home. And sometimes people just wanted to go to the hospital to see if they had COVID. Maybe they were still good enough to be left at home, but they wanted to go simply for the COVID testing, which of course, if they go and they take family with them during the height of respiratory illness season, puts them at risk by going into a medical facility, right, where there's lots of ill people. So leaving them at home and having that peace of mind, yes, this is what you have, it really helps them.
Chief Baker, Chief Halbrick, any thoughts on how the protocol development might influence your implementation or be something that you have to take on sooner rather than later?
I'm actually in the process of drafting an email to our MPD, so I'll have a better answer hopefully here shortly. But Yakima County has been, even though we're part of the Adams, Benton, Franklin, Lickitat, we all share the same MPD and the same protocols. We've been under kind of a mass overhaul. So where Chief Ford mentioned they have a seasonal or a pandemic protocol, that's awesome. I'm not sure if that's something that we have yet either drafted or implemented, but I'm sure going to find out.
I wanted to go to Aaron next. Olympic Ambulance, you're one of our private ambulance partners, our private EMS partners in this program. Curious to hear if you're thinking about implementing Triplex in a different capacity to what you heard from some of the other folks today.
Well, being that our footprint is pretty much in covering Squim and all the way down to Lewis County or Thurston County, excuse me, in Tacoma, right off the bat, the thing that interests me would be the employee testing, with the right off the bat. But there are some areas in that Clallam County that when we originally met, that I think we were brainstorming that there's a need out there as well.
Absolutely. And I mean, you all cover such a huge service region as well. So sounds like, thinking about where is there the highest need, right? And really focusing resources in that.
Yeah, because we with the recent rise in hospital admissions and things like that, we've seen some line staff issues. And then with that in our more of our metropolitan areas versus our branches out there in like Kitsap County and out there, we haven't seen that surge. So that's kind of where I'm thinking this would benefit, at the with the employees, just that testing part there. And
Aaron, because you're identifying a couple different areas where you would want to implement this testing solution, I'm curious to maybe take us a few steps down the road to the reporting side. You heard us talk about, the simple report tool, which is online. You could do it in the field. I'll bet Chief Ford has had some difficulties using the system. What do you feel like would be the right solution for you?
So that would probably where I would need to lean into some people that have used it before, but with my experience in getting Pierce County in the relationship with the EMS office here, there are some creative pathways that way, but it would be the other regions that they may have those connected resources. But for me, it would be a new learning experience on the reporting through those portals.
If you do think you want to use Simple Report, again, Bianca mentioned at the top of this call that we can connect you with the DOH surveillance team. They're really the folks that have spearheaded the implementation of Simple Report and, provide you with numerous materials that will help guide that implementation. If you think that's...
and that would be, I would have to ask the questions, mainly because when the pandemic started, my exposure was been the administering and the vaccine and every once in a while with the Pierce County Health Department was going out and doing some mass testing in some of the hotspot areas.
And I got a quick question for you and or Chief Ford. So you mentioned I'd started looking into the simple report, because a lot of our reporting, we typically we pass the buck to our local hospital most of the time. But in the event we're going to be potentially doing testing this way, what route have you or Chief Ford have you found to be most, we'll say, user friendly? You had mentioned contacting our local DOH or something to that effect, but do you have any recommendations for us who really haven't been on the reporting side of it just yet?
So for us, it had been before this, well, what we've been using was take-home tests. So we've been giving tests, so we wouldn't know if they had a positive. But
Correct.
for employees, is that went through our medical director, and they were doing the contact with public health, because they're also our infection control for the whole county with our medical director. So
Okay.
if you put it off on one more person, for employee testing anyway, you could go that way, but for public, where you're gonna do testing on the public, I would make that contact. It should be pretty easy to find who at your local health office is, who takes that information. And it could just been me that the simple reports didn't work for. Well, there's one other county didn't work for either. I don't want to just completely poo-poo it, but it seems intuitively easy, just the website was problematic to get into.
Good to know. I appreciate it. Yeah, because we, just like you mentioned, up to this point, we've done all at-home stuff. But now that we're going to be, the intention is to be testing the field with this new deal. We will obviously be subject to reporting. So I just kind of want to know what was the best way of going about it. So I appreciate it.
And Chief, you could imagine, just because I know a little bit of your how you leverage Louise, the reporting doesn't have to take place right at that sort of moment of patient care, but rather like when the teams come back, as long as it's within that 24 hours, you could have Louise be your dedicated simple report person. And if they're logging into simple report regularly enough, I think it's like every 90 days, he shouldn't encounter some of the issues with like getting timed out or having to reset passwords or some of the challenges that I assume Chief Ford ran into.
Okay, and so with that sort of reporting, I'm sorry, I don't mean to go down this rabbit hole, but with it going through our front desk person, that kind of like how we report it now with the tests that we're handing out, it's not doesn't violate any HIPAA rules, right? There's not anything that's specific enough to the patient where we have to be careful who's seeing it, who's having hands with it, anything like that.
So, I mean, it is a HIPAA compliant portal, but Louise would have to, or the person who's reporting it would enter like name and some demographics about that person. There is a demo site where you can really like play around with Simple Report as a tool. You can create basically what would be your workflow of a test site. It would be your agency, you'd put your agency's address, and then you can go through the process of creating a patient and then indicating the result. So if you wanted to play around with it in all of your free time as chiefs and busy EMS professionals, that is an option too. All right. Well, I know we have a couple new friends, new faces. I'm curious to hear, like, what are some of your initial reactions? Are you interested in continuing with this process and in this program?
We're with Benton County area, so it looks like Chief Albrecht's kind of got things under control. We'll kind of let him run with that. First, we've heard of it, so we thought we'd better get on and at least see what it's all about. And it's very interesting. Sounds like it'd be a good tool for the departments to use. Our department is not a transport agency; it's a more of a standby agency.
Mm-hmm.
But I mean, I can see where we could use it, especially for staffing if we had that issue ever. But
we're also, Benton County Fire District 6 is also in this program. I know Chief's not here today, but I'm not exactly sure where you're at in that area. But
we're in the city of Kennewick. We're, I guess, in the middle of District 1, but we're kind of a separate entity, a little different than everybody else. We're all volunteer. There's not a county or city paying anything for us. We do it all on our own. So a little bit different scenario.
Maybe I'll pass it. Yeah, Chief Busey.
We had free take-home COVID tests, both available on station and in our rigs. And I lost count of how many we actually went through throughout the COVID season, if you will. And so this looks like the next upgrade to that and providing a service to the community. We're rural, don't have a lot of access to immediate health care. So they use us extensively to come in for either welfare checks, obviously the home COVID tests. So this will, looking to make this an extension of that. Just got to see how that pans out, since there's not somebody in the building 24/7. We're staffed 24/7, but the office is only open so long, and folks have to go out on calls. May look to put them in our two primary response rigs. Our district's fairly large, so we're spread out. Just to be able to do some of that home testing and give people a more definitive answer, instead of hauling them in for something they don't necessarily need to be hauled in for. So just kind of playing with that. I'm not going to have an issue with medical direction. Just probably maybe rewrite our response protocol a little bit, as far as and that would be a great. I just saw Sean's thing come up about any protocol. So any protocols anybody has, if they could be shared, that would be great, or any policies in place, so we're not reinventing the wheel. But just looking forward to learning more and trying to think this through and how we can implement it. And I say this in a firefighter friendly way, in the most simple way, implement it in the most simple way possible. That it's not a huge additional burden on staff.
Aaron, I'm not sure if you're with us and can hear us, but yeah, I'm curious to hear some of your reflections from this session.
Hi, I am actually Sean Ford's neighbor here in Clark County. We used the device back during early time of COVID. So we ran quite a few of our tests through this machine before doing the at-home test. So we're pretty familiar with that. We are a response agency. However, we have a pilot program for a community paramedic program that goes into some of our low acuity calls. And we also tend to a lot of falls patients, so they don't return to the hospital. So I think that we potentially, besides using it for our providers, it would potentially reach into other avenues of our department.
Well, folks, I realize I could talk with you all afternoon about implementation, but I know you are very busy people and have other things to do. So I'll go ahead and wrap us up today with just some next steps. Sounds like we've got a lot of great interest for Triplex. Agencies are sort of at different stages in their journey to implement. We will send out a number of resources after this call, including the Triplex toolkit, which is on our website. We'll also share simple report training materials. We'll share DOH's medical test site license. We'll share video training materials about BD Veritor. But if you want anyone from Health Commons to come and do an in-person training, we are more than available. As you can tell, I love to do product demos, so more than happy to do more if folks are open to hosting. For those folks that are new faces to us, if you're interested in joining, you can reach out to us at First Responders at Health Commons Project if we're not already connected. And then this session will be posted on our website and sent around after the fact. And we do really appreciate hearing from you on how you felt like the session went, if you were engaged in the content, if you'd attend another one. So we will send a quick 5-6 question survey to you tomorrow. And we would just invite you to respond and let us know how we did. A huge thank you so much for joining us this afternoon. And we just not only appreciate you being here with us today, but for doing this work over the last year and last few months. So thank you again. Have good afternoons. Thanks, everyone.